Introduction to dental assisting. The dental assisting profession. Dentistry is one of the world's oldest medical arts. For thousands of years, people have tried to care for their teeth well enough to keep their mouths healthy and pain-free for a lifetime. The concerns of people through the ages have remained surprisingly similar, whereas the technology available for modern dental care continues to advance and better address those needs. As the profession has grown over the years, the roles and responsibilities for the various members of the dental team, including dental assistants, have become better defined. Formal education and a structured certification process ensure that patients receive quality care. A number of professional organizations exist to promote professional standards, advocate sound oral health care practices, and support members of the dental profession. Contemporary trends in dentistry. Patients today are more active participants in their own medical and dental treatment. Many make it a point to keep current on new developments in dental treatment, especially opportunities to maintain oral health and prevent dental disease from developing in the first place. Some patients have a particular interest in improving the appearance of otherwise healthy teeth, or they want to put the finishing touches on restorative dental work by seeking out the latest techniques in cosmetic dentistry. Cosmetic dentistry includes many techniques and procedures already practiced in dental offices, but begins by examining the patient's entire oral cavity, including the shape, color, and structure of teeth, and working to improve overall appearance or aesthetics. Television, advertising, and other visual media have a powerful influence on the expectations of many patients. Along with questions about brushing, flossing, rinsing, and other preventive measures for better dental health, you can expect to answer numerous patient questions about treatment options that have a purely cosmetic or aesthetic purpose. Whitening. Your teeth may appear increasingly stained or worn. Habits such as drinking tea or coffee and chewing or smoking tobacco can increase this appearance. Whitening, or bleaching, has become one of the most requested services provided in dental offices and is often performed by dental assistants. Whitening materials penetrate the tooth's enamel into the dentin. A light source or heat is used to speed up the lightening process. Patients not interested in undergoing whitening treatments in the dental office may instead ask you about commercially available home whitening treatments. Veneers. Veneers are thin layers of acrylic, composite, or porcelain placed on the outer surface of the teeth to improve their appearance or shape. Their placement requires little, if any, removal of existing tooth structure, but may require some surface preparation before they are bonded in place. Some veneers require routine polishing and regular maintenance after they are placed. Others are more durable. Resin and porcelain are two of the materials frequently used for veneers. Implants. Dental implants are a popular method of replacing one or more missing teeth. Implants are metal devices surgically placed into the jawbone and allowed to bond with the surrounding bone tissue over a period of 6 months. After successful bonding, the implant may be used to anchor in place a single crown, a bridge, or a partial or full denture. Education in dental professions. Dentists. Dental education accreditation began in the early part of the 20th century and is intended to ensure the quality and continuous improvement of dental and dental-related education in the United Kingdom. Typically, a dentist completes an undergraduate education and goes on to study at a dental school, which includes both coursework and clinical practice on patients. When the dentist graduates, he or she receives either a Doctor of Dental Surgery, DDS, or a Doctor of Medical Dentistry, DMD, degree. Many dentists go on to additional specialist training. After obtaining a license to practice, most dentists go into general dentistry, where they handle a wide variety of situations and patients. Dentists today are more involved than ever with their patients' overall general health. While treating the gingiva and teeth, many detect early signs of other health conditions that require referral to a physician. Dentists may employ in their offices like dental assistants, dental hygienists, and dental laboratory technicians. Dental assistants. Most dental assistants acquire their training in community college, trade school, or technical institute training programs. Some dental assistants are trained in schools associated with the armed forces. An accredited training program for dental assistants includes both classroom and laboratory instruction in dental assisting skills. Students also gain practical experience in dental offices, clinics, and schools before they graduate. Dental hygienists. Dental hygienists provide preventive dental care by removing calculus, stains, and plaque from teeth, and by teaching patients about good oral hygiene. Additional responsibilities can include developing dental radiographs, applying fluoride treatments, and performing other patient care tasks. Dental laboratory technicians. Dental laboratory technicians, also known as dental technicians, provide support to dental practices by filling prescriptions from dentists for crowns, bridges, dentures, and other dental prosthetics. They customize each prescription according to models of the individual patient's oral cavity, bite, and adjoining teeth. Dental technicians are skilled artisans whose work is detailed and demanding. They may work for individual dentists or for dental laboratories. Some technicians train in business and management and go on to establish their own dental laboratories. Professionalism in dental assisting. Dental assistants are trained, multi-skilled professionals who are valuable members of the dental team. During the course of the day, they may perform a wide range of tasks. They may function as clinicians who care for patients and see to their well-being, as educators for better patient dental health, as patient advocates who respond to the needs and concerns of their patients, and as administrators who help run and maintain the dental practice. Some are very versatile and can run an office from the business end. Making and scheduling appointments, managing inventory, and keeping up with insurance submissions and the accounts receivable and payable are just a few other areas in which a dental assistant can be skilled. A wide range of skills and knowledge make for a truly valued dental professional. Regardless of the type of practice where they are employed, dental assistants perform their tasks with professionalism and attention to detail, and continually remember their own importance to the dental team. Personal characteristics of a dental assistant. Personal characteristics, such as honesty and dependability, are the foundation of personal character. If you do not already possess the following important personal characteristics, work toward making them a part of who you are both as a person and as a professional dental assistant. In some cases, your success as a dental assistant will depend on it. Dependability and punctuality. Your team members and patients expect you to be there to help them. If you miss work or are late, someone else must be found to do your work in your absence. Adaptability. As you move through your day, be willing to take on unexpected roles or duties when necessary. If the clinic or office where you work remains open some evenings or weekends, be willing to work your share of those hours. Maturity. Remain calm in emergencies and do what you can to help. Listen to constructive criticism without becoming defensive. See it as an essential part of learning to do a better job. Accuracy. Your patients and the dentist you assist depend on your accuracy and close attention to detail. Mistakes can be costly to patient health and to the reputation of the practice. Some may even result in legal action. Honesty. If you make a mistake, admit it immediately. Do not blame others for your mistakes. Refrain from using office resources or time for personal business. Empathy. Even in difficult situations, try to see things through your patient's eyes. If you can, imagine how you might feel in a similar situation. Help ensure patients get the care they need, even if they are frightened or in pain. Courtesy and patience. Graciously welcome all patients and families who come to you for care. Exercise patience in your interactions with all those who come to you for care and with your colleagues. When asked to explain procedures to patients, speak slowly and remember to use words and explanations the patient is likely to understand. Patiently repeat yourself if necessary, or choose new words to explain. Tactful communication. Do not discuss your personal problems with patients or with colleagues in the dental office. Choose your words carefully, whether in casual conversation or difficult treatment situations. Choosing the right words at the right time can make a great deal of difference to your patients and colleagues. In some cases, you may be able to reassure a nervous patient or redirect an unsettling discussion. Positive attitude. Be confident in your abilities as a trained health professional. You have the responsibility to provide quality care and the training and ability to do so. Become and remain a team player. Successful patient care depends on a team effort. Initiative. Work with a minimum of instruction or supervision. Do whatever is expected of you by your fellow team members. When your own duties permit, volunteer to help others who may need it. Trustworthiness. The most important personal characteristic of a professional dental assistant is trustworthiness. You must be able to keep confidential all patient information, whether personal, financial, medical, or dental, of which you become aware. Information that must be kept confidential includes the following: identity of patients, procedures completed, conversations, financial arrangements. Always respect patient confidentiality. Safeguarding confidentiality goes back to the earliest traditions of medical care. Failing to maintain patient confidentiality is against the law. Betraying patient confidentiality can ruin the reputation of the practice where you work and your own professional reputation. A breach of confidentiality can result in legal action against all parties involved. Professional appearance. Maintaining a professional appearance includes personal cleanliness, good grooming, and appropriate clothing, but it begins with overall good health. Any health professional serves as a model of good health to patients and colleagues. In addition, dental assistants perform work that is physically demanding. They must stay on their feet much of the day and must always remain alert during procedures and patient care. Adequate rest, a balanced diet, and sufficient exercise are essential. Other basics of a professional appearance follow from this. Hygiene. Take a daily bath or shower. Use deodorant. Maintain good oral hygiene of your own, including fresh breath. Clothing. If you wear a uniform to the office, Make sure it is freshly washed and ironed. Clean, but wrinkled, uniforms are not acceptable. Unclean garments can harbor pathogens, germs and bacteria that can pass along illness and disease. If you do not wear a uniform, avoid choosing clothing that is too trendy or suggestive. Make sure to wear appropriate undergarments under all clothing. Repair or replace any clothing that is torn or stained. Make sure to sew on any missing buttons. Shoes should be clean and polished. Make sure laces, if any, are clean and are the proper length. If your office allows sneakers to be worn to work, wear all white ones. Check for runs or snags in any nylon hosiery that is part of your outfit or uniform, and replace as needed. Hair. Wash your hair regularly to make sure it looks and smells clean. Use clips or ponytail holders to style long hair back and away from your face. Makeup and fragrance. If you wear makeup, keep it to a minimum and use lighter colors appropriate for daytime. Keep scented products, such as scented body lotions or sprays, to a minimum, or avoid them altogether. Limit the use of perfume, because it may be offensive to others. Some patients or co-workers may not be able to tolerate strong scents and can experience allergic reactions. Avoid using tobacco products of any kind. Their odor permeates clothing and lingers in your hair. Fingernails. Keep fingernails short. Long fingernails interfere with dental procedures and can rip protective gloves. Long fingernails are difficult to keep clean. They are one of the main spots on the body to harbor pathogens that can pass along illness or infection to you or your patients. Nails should be neatly manicured, and any polish should be clear or light-colored. Jewelry. Keep jewelry tasteful and to a minimum. Limit earrings to a single pair of small studs. Remove or conceal any body jewelry. Wear rings with caution. Some can puncture protective gloves or interfere with procedures. Commitment. Some dental assistants perform primarily administrative tasks in the reception and office areas of the practice. Others work mostly chairside with the dentist, assisting with procedures and patient care. Ideally, dental assistants would be familiar with the demands and duties of both settings and be able to assist or take the place of absent colleagues. Sense of responsibility. As a dental assistant, you share with your colleagues on the dental team a sense of responsibility for each patient. Your responsibility begins with refraining from harming any patient and doing all you can to promote overall patient well-being. It continues by treating all patients with compassion and empathy. As a dental assistant, you share responsibility for patient well-being, which continues with making sure you are qualified and competent to perform any procedure you are asked to complete. Doing something for which you are unprepared or unqualified can endanger the well-being of everyone, including yourself, your colleagues, and your patients. Professional attitude. Your education as a dental assistant has provided you with the necessary technical skills and knowledge to do your job well. A professional attitude enhances that knowledge by making it clear to your patients and co-workers that you are a professional who knows the value of your work and your importance on the dental team. It is important to remember that a dental office is a business and must be run efficiently. A professional attitude shows in several ways. Timeliness is important. Your colleagues and patients are counting on you to be where you are needed, when you are needed there. Respect the office as a business. Work efficiently, do not waste supplies, and be professional at all times. Wear a clean, pressed uniform or other appropriate clothing. Pay attention to other details of a professional appearance, as discussed above. Take the time to do your job well. Perform all your tasks, whether chairside or in the office, with all the care and accuracy possible. Maintain a positive and respectful attitude regarding your work, colleagues, and patients. Respect cultural diversity. Commit to doing your best at all times. Demonstrate initiative and responsibility. Prioritize your tasks according to importance, but perform each one thoroughly and well. Adapt to changes in your workplace and duties as needed. Take advantage of continuing education programs to enhance your skills and knowledge. Follow all office policies and procedures. Safeguard the confidentiality of patient information. Finally, serve as a positive role model for other dental assistants in your community. Skills and knowledge, professional development. Your education as a dental assistant does not end with graduation or certification. It will continue for as long as you remain in the profession. Professional dental assistants seek out and take advantage of opportunities to increase skills and enhance knowledge. If you perform office or administrative tasks as part of your work, you may enroll in courses to update your computer and software skills. Whatever forms your professional development and educational efforts take, remember to incorporate your new knowledge and skills into your daily work as quickly as you can. Dental assistant responsibilities. As the name indicates, a dental assistant supports the dentist in various phases of the practice. In addition to caring for patients and assisting chairside, most dental assistants perform some administrative tasks during the course of the day. Whether you are a DA or a CDA, your responsibilities may include many or all of the following: greeting patients and office visitors, answering the phone, instructing new patients on customary office practices, handling patient insurance forms, helping patients feel comfortable about their dental treatment, managing confidential patient medical, dental, personal, and financial information, maintaining examining rooms, keeping examining rooms properly supplied, assuming overall responsibility for infection control, including preparing and sterilizing instruments and equipment, scheduling patient appointments, communicating with suppliers and other team members about supplies, billing, and administrative matters, screening sales representatives, screening other office visitors, paying bills, billing patients and others. Dental assistant roles. Depending on licensing requirements and local practices, you may also take on certain specific roles. As you carry out your work, you may find yourself in the role of chairside assistant. In this case, you and the dentist sit on either side of the patient's chair. Some roles may include these responsibilities: obtaining and recording patient medical history and vital signs, preparing patients for examinations or treatment, sterilizing instruments, selection and preparation of armamentarium, administering medications or injections, maintaining the patient's chart, mixing dental materials, managing infection control procedures, pouring and trimming models, providing oral evacuation during dental procedures, exposing and processing radiographs, ensuring compliance with other safety regulations, recognizing and responding to medical emergencies. You may also serve as a circulating assistant or floater. In this situation, you may help out anywhere in the practice where your assistance is needed, from preparing instruments to providing patient education. Dental hygienists. Most registered dental hygienists, RDH, have attended 2 or 4 years schools, received at least an associate's degree, and passed state written and clinical examinations. A dental hygienist usually provides patient education about oral health along with removing plaque, calculus, and other deposits. Dental hygienists may also develop radiographs, apply fluoride and dental sealants, and administer oral anesthetics. Dental laboratory technicians. Dental laboratory technicians, also known as dental technicians, follow written prescriptions from the dentist to make crowns, bridges, and dentures from impressions taken by the dentist. A certified dental technician, CDT, has passed an additional examination to receive that credential. Although dental laboratory technicians usually work in a separate dental lab, they may occasionally come to the dental office to meet with the dentist and the patient. Their work is important to the success of the whole dental team. As a dental assistant, you will likely communicate regularly with the technicians to provide special instructions and information about the time requirements for a particular case. Office staff and supporting services. The dental office staff may include a receptionist, administrative assistant, and others who provide a variety of support services, including scheduling patient appointments, assisting with computer technology, and processing insurance claims. Others who are not in the office provide valuable services as well. A dental supply person represents one or more dental supply companies and will regularly call on your office to take orders or explain products. In contrast, a detail person represents a specific company, usually a pharmaceutical company or manufacturer, who will visit your office to discuss his or her company's products. Dental equipment technicians maintain and repair dental equipment. Functioning as a team. An effective dental office team is key to providing the highest quality patient care. A patient may not understand the responsibilities of all the team members, but that patient does know when his or her situation is handled smoothly and professionally.